Hi and welcome to my channel on mental health. Now, over time, mental health in general and illness, it's the stigma that was created, which was portrayed towards mental health, has got better, but one illness still carries that, or one of the illnesses that still carries that stigma that was portrayed around it. The discrimination as well is schizophrenia, and schizophrenia is greatly misunderstood of how it's been perceived, the portrayal around it, how the perception towards schizophrenia. So that in itself doesn't help those that are suffering with the illness. It's an illness, it's a complex illness, but it's not who they are. They are not their illness, and greatly misunderstood by a lot of the time media, social media, like the media, I should say, and how other people pick up on that and believe that it's true. And that's where the misunderstanding comes in. By many people may think that they are violent people and they go out and with acts of crime and so forth like that. Many a times, most of the time, they're the ones that are the victims with the crime. They become the victims. Suffering with the illness can be quite challenging for a person and quite frightening in itself as well. How the schizophrenia, the illness, is how somebody feels, their thoughts, what they think, their thoughts, and how they experience the world around them. Their reality may become different to somebody else's reality, the world around them, how they feel and think, due to the illness in itself, the symptoms, the common symptoms like the audio hallucinations, like seeing or hearing things, the thoughts there, my mind's gone blank. The thoughts there, how they feel, how they feel. Some people may get paranoia, but not everybody that suffers with the illness gets the same symptoms and may feel differently with it, how it affects them differently as well. So getting a better understanding, raising that awareness there for schizophrenia, because it's, like I said, it's greatly misunderstood. Okay, they're still learning about things, but many people may just presume or feel that it's a lifelong illness and just be given medication, and that's it, when there are other things as well that can help with the illness in itself. Some people may not know that. Some people, like I said, some people may just think that there's nothing much you can do for it, and being told it's a lifelong illness in itself. Like I said, there are other things that can be done for it. There's recovery. Recovery is about getting to that right place, a better place from where they are, having a good quality of life, regaining that back in recovery. Some people fully recover from it, and become symptom free. So there's a lot of misconceptions as well and myths around schizophrenia in itself. It needs to be brought into the light a bit more, bring it into the light and break down that stigma that is revolved around schizophrenia and how people portray it, saying that they're like they can become violent when quite often, like I said, they become the victims in a crime in itself, how it's been portrayed. So we need to break down that stigma and understand it better for ourselves, but also for those that are suffering with the illness. They are not the illness, they are not schizophrenia, it's not who they are, it's just a diagnosis that has been given to them, and some people feel to them that it's a label to them, it's not who they are. And we've got to remember this and acknowledge it, that it's not who they are. They too can have that chance to regain a better quality of life, a good quality of life, regain back good relationships, having good healthy relationships again, and also as well, like employment, what suits them, what's going to help them and benefit them, what they can do, and quite often as well, like voluntary work, voluntary giving back into the community is going to better their mental health, it's going to better their quality of life. So having schizophrenia, there shouldn't be any barriers up around it, like the quality of life. Like many people may think that they will have a poor quality of life, not very good relationships, even goals, setting out goals, doing things that they can enjoy doing, but at the start it needs to be supported there to help with their recovery, because there is recovery with schizophrenia. So being supported, medication at the beginning may be needing something like that to help to stabilise and help them function a bit better within their self. But alongside that, having other treatments that's going to benefit, like the talking therapies, CBT therapies that can help understand things better, learning more about how it's affecting oneself, the illness in itself. So the talking therapies, having a support network around for people that they can trust, they feel safe with, they know they can talk to as well, is very important and beneficial for their mental health as well. So there are things that people can do, and along the way, learning self-help care for themselves, learning to be more independent. It is possible. We should encourage that and have that hope there with schizophrenia. Like I said, misunderstanding, being misunderstood, the illness in itself, bringing it more into the open, raising awareness for schizophrenia, bringing it into the light and encouraging people and letting them know that there is recovery. It doesn't have to be like it is all the time. Things get better over time. Things get better with it, but having those right treatments, that right care there at the start, and learning to become more independent, because like I said, having schizophrenia doesn't stop somebody from having a better quality of life. Like I said, that's one of the barriers that is normally put up with schizophrenia or relationships, finding it difficult with like relationships. That is what recovery is about. It's all about regaining that back, and it is possible to do. It should, like I said, it should be encouraged a bit more and understood a bit more, And that stigma, the stigma that is created around it, the discrimination around schizophrenia still, when over time things have got better, like I said, with stigma, but schizophrenia is one of the illnesses that is still carries that stigma and that's discrimination. And normally it's due down to misunderstanding things, the myths around it, and so forth like that. We should educate ourselves a bit better with the illness and know what it's about and get that true meaning of what it is and how it really do affect people, having that true meaning there rather than the false misconception, the false there that creates around it and then builds that stigma around it. People making their own minds up and how they perceive people with schizophrenia. Like I said, quite often, a lot of the time, probably 99% of the time, they become the victims of some sort of crime or something like that, because they're the ones, they've got an illness. You've got to remember the illness in itself can make a person quite vulnerable. The challenges that they have with the illness can be quite frightening. So they're not gonna, you've got to think they're not gonna put themselves in a predicament that's gonna make them even more vulnerable. If anything, like I said, they become the victims of crime. Even though, like with the thoughts, they may get those thoughts or those voices of something in their mind telling them to do something that they don't want to do. It's like a bully in their mind, like being controlled by something. It's not who they are, and quite often they try to challenge that. It's not something that they wish to go out and do. You know, you've got to remember that there are people that go out and commit crimes that do not suffer with any mental health issues, and they go out and commit those crimes, those horrible crimes, I should say. But you don't hear much of that, the stigma around that. But as soon as somebody that has an illness, suffering, say, with schizophrenia, it's mentioned and so forth like that. But that's far between something like that happening with somebody with an illness in itself. Like I said, it can be quite challenging for them and quite frightening. But I would say that we need to bring it into the light and bring hope to it, bring hope for schizophrenia recovery. People can live a near to normal life, and some people do fully recover. We need to acknowledge it, we need to understand it better and put away from that, take that stigma away from it and that discrimination that is portrayed around it. Like I said, it can help those have a better quality of life without having to carry that with them. So I'm going to end the video there. Please share this video because it's very important. Like I said, many people may feel that there isn't much you can do for that illness when there is. There is things that can be done and it can be improved over time. Everybody's journey, everybody is different. Everybody heals at different speeds, but somebody can, or people with that illness can get to a better place and have a better quality, a good quality of life, more independently, and learn to cope better with the illness And like I said, some people fully recover from schizophrenia. There are many documentaries about schizophrenia. There are documentaries out there. Maybe educate yourself and find out more about it, because it's a very complex illness, but it is possible. There is recovery with it, and we need to pull away from that stigma, raise that awareness there, raise the awareness, bring it into the light. So please share this video, and don't forget to subscribe, and I'll see you in the next video.